Thank you, Deputy President. Deputy President, the opposition emoting and waxing lyrical about cost of living is honestly a little bit rich. It's a little bit rich. Why? Because I was here in the first term of government, and I remember that they voted against every single cost of living measure that this Albanese government put forward to this parliament, every single one of them. So it's a bit rich that they would stand here, in fact disingenuous that they would stand here and profess to actually care about the Australian people. Now, we're a government that understands that Australian families, households, businesses are under pressure. Cost of living was the dominant issue in our first term of government. And unfortunately, we are still dealing with an inflationary hangover. That is evident. We understand that millions of Australians will be disappointed with this interest rate rise. But we're a government that is not here to emote. We are here to actually do something about this and support Australians during this period. And what are we doing about that? There's a whole suite of measures that I can describe. Healthcare has been a big area of action. Housing, after a decade of Liberal and national neglect. I was about to say coalition, but they're not that anymore. I don't know what they are. The skills shortage, absolutely forgotten about under a decade of drift under the Liberals. And of course, we are acting on wages. If we just take one area, healthcare, that's an area I can speak about. I have some experience in healthcare. We have, with $8.5 billion, pumped in the biggest investment in Medicare's 42-year history. Medicare is a great Labor legacy. It was born out of the Hawke government. Incredible vision. And before that, Medibank. It was resisted all the way through by the Liberals. They thought that free healthcare was ridiculous, that no one should have universal healthcare. That is not what that's not the vision that a Labor Prime Minister, Bob Hawke, had. And so with $8.5 billion, we are actually seeing a lift, green shoots of recovery in bulk billing. Since this was rolled out on the 1st of November, we've seen about 1,300 clinics take up bulk billing. Imagine that, going and seeing your doctor and not having to pull out your credit card, just show your Medicare card. We've also rolled out 120 urgent care clinics, which have now seen 2.2 million presentations. A third of those presentations are actually kids. So these are clinics that are open from morning till evening, usually 7 days a week, and they're staffed by local doctors, and they are walk in, you don't need an appointment, and they're bulk billed. And the tests or diagnostics that are ordered at these clinics are also bulk billed. And so, of course, families with children are flocking to these clinics. Imagine on a Saturday when you've got a footy injury or some other ailment, maybe it's a sick child running at high temperature or gastro, and you don't want to be queuing up for hours in the emergency department, you can go to your urgent care clinic. Victoria now has 6 of these clinics open, and there's another one that will be open in Stonington East in my old electorate of Higgins. And these clinics have already seen a 6% reduction in emergency department presentations in Victoria. That is how we take pressure off our public hospitals, by providing options for Australians in the community. We rolled out cheaper meds. Cheaper medicines are now $25 per script as of the 1st of January. It's never been that low since 2004. That was the lowest that it was, and it's again $25 per script. In addition to that, we are looking after those 1 in 7 Australian women who have endometriosis, with 33 endometriosis clinics and pelvic pain clinics that have been rolled out throughout the country. These clinics are providing life-saving care to women who have been forgotten, unheard by the medical profession. Endometriosis is not a condition that I was ever trained on when I went through med school, but we have elevated it thanks to a near $1 billion investment in women's health that this Albanese Labor government have invested. In addition to that, we have a pretty comprehensive program on mental health supports. As of a few weeks ago, Medicare mental health check-in started. This is worth Googling. It's an online digital resource which is available when you need it, where you need it, whenever you need it, and it's evidence-based. We know that there is more to do, but we are not just talking about it, we are acting.
Ananda-Rajah, your time has expired.